Your friend collapses. A coworker starts choking. Are you prepared to respond? The key to understanding rescue operations, such as CPR and the Heimlich maneuver, is understanding why they work. In today's episode of Science, Why It Works, we'll explore the science behind first response and rescue operations. We are focusing on two of the most essential body systems today, the circulatory and respiratory systems. The circulatory system is a network of veins and arteries that transports blood cells carrying oxygen and other nutrients throughout the body. The heart is the center of the circulatory system, pumping the blood throughout the body. The heart contracts based on intrinsic electrical impulses generated at the SA node and transferred through the AV node, the AV bundle, and the Purkinje fibers. The cardiac muscles receive oxygen and nutrients through the coronary arteries. When a blockage occurs, the cardiac cells are starved for nutrients and shut down. This is a myocardial infarction, or a heart attack.
Your circulatory system keeps you alive. Without your blood pumping, you will not survive. Without oxygen, the muscles quickly die. So take care of your heart and don't eat those fries.
The respiratory system works closely with the circulatory system to provide oxygen in the blood. The core of the respiratory system is the lungs, large balloon-like organs which hold the bronchi where gas exchange occurs. In a heart attack or drowning emergency, this process is disrupted. Without oxygen, the body quickly deteriorates. After 4 to 6 minutes, this hypoxia transitions to apoxia, in which significant tissue damage occurs.
Your heart is important, but your lungs are too, 'cause it's the alveoli that exchanges the CO2 and O2. If you stop your breathing, you might not stay alive. Get some help quickly so you can survive. Yeah.
Let's talk about CPR. CPR stands for cardiopulmonary resuscitation. It is the best way to provide treatment before the EMTs arrive. Current CPR methods involve repeated cycles of 30 chest compressions and 2 breaths. However, statistics show that constant compressions with no breath may be more effective. The chest compressions press down on the heart, forcing blood between chambers. Ultimately, the goal is to restart the heart. When this isn't possible, forced circulation is the next best thing. The goal of the rescue breaths is to force oxygen in the lungs. Even though you are exhaling the air, exhaled air is made up of 17% oxygen compared to 20% in normal air. It isn't perfect, but it could save a life.
Cardiopulmonary resuscitation. How do you restart the heart? 30 pushes, then 2 breaths. Repeat until their heart's beating. Keep doing that CPR to keep them alive.
Let's go over the steps to CPR. Please note that CPR should only be performed by trained and certified individuals. Performing it without the proper training can leave you liable. First, assess the situation. You never want to put your own life at risk. Then, assess the victim. Check for responsiveness and breathing. If they are unresponsive or are not breathing, call 911 right away. Then we follow the ABCs. Open the airway, check for breathing, and give compressions. Open the airway by tilting the head back. When giving rescue breaths, exhale once, wait for a second to allow them to exhale, and breathe again. Give enough air to make their chest visibly rise. When giving compressions, use both hands, with fingers intertwined and elbows locked. Place the base of your palm on the victim's sternum between the nipples. Make sure not to press too low on the sternum, or the xiphoid process may break off and puncture a lung. Press down about 1.5 to 2 inches, about 100 times per minute. Ribs may be broken in this process, but broken ribs are preferred to a stopped heart. Only stop CPR when the patient resumes breathing, the EMTs arrive, or you become too physically exhausted to continue.
The Heimlich maneuver is used when a victim is choking or when a foreign obstruction enters the windpipe, preventing breathing. Often, the victim retains consciousness and panics. Clutching the throat with both hands is the universally recognized distress signal for choking. The Heimlich maneuver forces air out of the lungs and creates a cough, which ideally expels the foreign object in the airway.
If you see a person who you think is choking, first try to ask the person,
"Are you okay now?"
If they nod, tell them that you would like to try to help them. Stand behind the choking person facing their back and wrap your arms around their midsection. Next, make a fist with your dominant hand and place your thumb directly above the navel. Grab your fist with your other hand, covering your fist, and make a quick upward thrust into the abdomen. Continue to perform sharp, quick thrusts until the object is expelled, person falls unconscious, or help arrives.
There's something stuck in your trachea. Who you gonna call? Choke busters. If you start choking and it don't look good, who you gonna call? Choke busters.